Hi, my name is Gabrielle. I am 20 years old, and in about a week I am having rhinoplasty done by Dr. Williams. I have a semi-deviated septum, which doesn't affect my breathing, but it makes my nose very crooked, and I also have a nasal bump. So I've wanted rhinoplasty done since as far as I can remember. I had researched other doctors in my area and actually made an appointment with one, and he called me back and canceled it and said, if you want rhinoplasty, you have to go see Dr. Williams because he is just so amazing. So a few days later, I had my appointment with Dr. Williams, and I just knew I was in the right place. He made me feel so comfortable and really understood why this surgery means so much to me. He listened to everything I want my nose to look like. And I remember him saying, I have so many young women come in here and tell me that they take pictures with their friends, and when they look at that picture, all they can think of is, oh my God, look at my nose. And that really connected with me because I feel like that a lot of the time. I remember I told my best friend that I'm finally getting this surgery done because she knows I've wanted it forever, and she couldn't believe that I was actually going through with it. And she said, but your nose is what makes you. And I was a little offended by that because I don't want my nose to make me. I want what Dr. Williams said. I want my nose to disappear and people to see my eyes and my face and my personality and make that what makes me, not some weird looking nose. So I know that Dr. Williams is going to change my life with this surgery, and I'm so excited for it.
Actually, you can see the what you're trying to do through an endonasal approach. Get there, Freer, please. Is create an optical cavity so that you can see just as much as you can through an open approach. You can see here's our intercartilaginous incision, and there is the dorsum right here. So we will now be able to take this down in an incremental fashion, and I like a 15C for that. Here's your bump. And if you look closely at it, you can see pretty symmetrical. Right in the center there, you can actually see the septum. Q-tip. You see the upper lateral cartilages as they come in on both sides here. And there's the septum right down the middle. And then there's a little bit of nub of the bone on it. Typically a larger nose, more of the hump, or bump, if you will, is cartilaginous, and that's somewhat of a misconception. People tend to think that there's a lot of bone, but in reality, the bone is the small part of it.
And 6 days ago, I had rhinoplasty done by Dr. Williams. So, going into surgery, I was extremely nervous, but the staff and the nurses at the surgery center are phenomenal. They make you feel completely comfortable and take care of you before and after the surgery. Because I know after the surgery, you're a little bit crazy, but that wears off. I wasn't really swollen or bruised for the first 2 days. The third day is I woke up and I had 2 black eyes, but I guess that's not really the normal, but it happens to some people. The worst part is, for me, was the stitches in my nose. Those got pretty sore, so I did have to take the pain meds to be able to sleep at night and things like that. I stayed home and relaxed for the first 2 or 3 days, and the last 2 days I've been working. So going into public, you get crazy questions of who broke your nose, so that's always fun. But I do get my nose splint off today, and I'm super excited because I have not seen what my nose looks like, and I know it's going to look great, so I'm very excited.
Hello, Gabrielle. Hello. How are you?
Good, how are you?
Good. How was your week?
It was good.
Yeah?
A little sore, but not too bad.
Yeah, a little black and blue.
Yes.
Okay. Other than that, not really a lot of pain?
Not really. I took the pain meds to help me sleep and stuff, but
Jackie told me you made a little video.
Yes, I did.
Did you have fun with it?
Yes.
I told her, make sure, I only have one rule, is that you have fun.
Mm-hmm.
So, you excited to get splint off?
Yes. Very
Doesn't hurt. Takes me about 2 seconds.
Mm-hmm.
Okay, pop it off. And I bet you're very excited to take them off. Alright, we'll just cut that out. Alright, so just got my hands washed here, and this really doesn't hurt. But this is the fun part, okay? So all you have to do is put your head back.
Okay.
And bring you up to the chair. It tickles a little bit, by the way. Just
Okay.
like run this up over there and kind of, and probably you've been itching a little bit anyway.
Mm-hmm.
So just kind of slip here. You jumped in the shower this morning?
I did.
Got it all wet?
It felt great.
I'm sure it does. I think that's probably one of the more annoying things, right?
Uh-huh.
Not being able to get your face wet
Right.
for a few days, huh?
Uh-huh.
Well, things could not have gone better, and I'm very excited because now and then we had a home run. I think we had a home run.
Oh.
So no, it looked great. I don't know if you've seen some of the first set of photos,
Uh-huh.
but that's the cool part. All right, I'm not hurting you, am I?
No.
Okay, cool. Yeah, it really helps when you get it wet because then the splint just comes off a lot more easily.
Mm-hmm.
What'd you do this week? Just hang out at home?
Pretty much, yeah.
Yeah, right.
I worked at my job this weekend and I got
Did you?
some crazy questions, but
Yeah. Oh, from people, you mean?
oh yeah.
Yeah. What's going on with your nose?
Right. Who broke your
Did
nose?
you break your nose?
Yeah.
All that, right?
Uh-huh.
Yeah, the normal questions, I guess. And what I do, so I put the sticky compound on here
Uh-huh.
because I don't want the dressing the splint to fall off that first week.
Right.
And so that makes it a little tougher. Just a little bit more difficult getting it off, but this way it doesn't fall off on you and it protects your nose in case you were to bang your nose a little bit or something.
Mm-hmm.
Okay, peek.
That's good. Oh wow.
Now you're still a little swollen right
Yeah.
here. But you see the difference, don't you?
Mm-hmm.
Huge difference. You like what you see so far?
Yes. I do.
Kind of weird to see a different nose on you.
Yeah.
So
Definitely
a
different.
couple things. Sue's going to go through.
Mm-hmm.
Not bad. You have one little bruise right there.
Mm-hmm.
So that's awesome. Sue's going to go through a few things, what to do the next couple of weeks.
Mm-hmm.
And I'm going to want to see you back in about 3 or 4 weeks.
Okay.
The only thing I worry about is I just don't want you to bang your nose.
Mm-hmm.
And then when we get you back, we'll get your before and afters up for you.